Everybody in.
In middle school, I got my first contract right after grad.
All right, there we go.
Hey, good evening, everybody, and welcome to our VBC Happy Hour for the September 18th, which is the 76th birthday of the United States Air Force, as well as the 76th birthday of the CIA. I think the National Security Agency, I could be wrong about that. Certainly the Department of Defense, all passed with the National Security Act of 1947 and put into effect on this date in 1947, September 18th. My name is Todd DiPastino. This is the VBC Happy Hour, and we do have a very special program today. We're honored to have Undersecretary of the VA Benefits, Joshua Jacobs, with us. Hello, Undersecretary Jacobs. How are you?
I'm doing well, Todd. How are you?
Good. You're joining us from Washington, D.C.?
I sure am.
We are up against something called the Pittsburgh Steelers. We are a Pittsburgh-based organization. Many of our folks here are Steelers fans, and I'm afraid that some of them, like Colonel Brad Washabaugh, will be departing our program when the Steelers kick off. So you might want to have your more interesting comments toward the beginning of the.
I will do my best, but I will say, and at the risk of offending the majority of the folks on the line, I'm actually a Seahawks fan, so I understand the pull for the football team.
That's right. You went to the University of Washington, correct?
I sure did.
Okay, very good, very good. Well, once again, I just want to welcome everybody. I'm Todd DiPastino. We're the Veterans Breakfast Club. We're a nonprofit based here in Pittsburgh. We've been around for 15 years doing events where veterans share their stories. And occasionally we do special events like the one we're doing tonight, where we have esteemed guest Undersecretary of Benefits of the VA Benefits, Joshua Jacobs, with us. He is kind enough that he's going to be doing a lot of Q&A with us. So we want to get to him and started right away. I do want to thank our sponsor, which means I've got to get my PowerPoint up here, and you all know who our sponsor is, Tobacco-Free Adagio Health. We're very grateful to them for sponsoring our VBC Happy Hour. I recently heard from them, by the way, that they are going to be re-upping their sponsorship of VBC Happy Hour. They've been sponsoring for years now. Adagio Health is a healthcare provider based mostly in Pennsylvania and West Virginia, and their tobacco-free program, which helps to underwrite VBC Happy Hour, provides health, wellness, and nutrition services dedicated to preventing and reducing tobacco use, to educating people about the hazards of smoking, and advocating for policies to build healthier places to live, work, and play. You can find out more at tobaccofree.adagiohealth.org. And by the way, if you know somebody looking to quit smoking, they have a wonderful quit line, which is a counseling line, a free counseling line, 1-800-QUIT-NOW, 1-800-QUIT-NOW. You could go call that number and set up some telephone counseling to help you quit smoking. Before we get to our guest, I do want to let people know that we have a special event coming up on Thursday night. I'm deeply grateful to Ben Wright and to Greg Yost for agreeing to head this discussion that we're going to have on September 21st, which is International Peace Day, UN International Peace Day. We're going to have a discussion about just war. What makes war just? Can war have rules? And Ben Wright and Greg Yost will be leading the conversation, and we'll have others kind of contributing to the conversation and the discussion. I hope you can join us for Thursday night, 7 p.m. And then next week, we have another wonderful program. Best-selling author Alex Kershaw is going to be on discussing his new book, Against All Odds, which is the story of 4 Medal of Honor recipients from World War II. We've had Alex on before, and everybody knows he's absolutely terrific. And so we look forward to that program very much. Okay. Well, let me introduce our special guest this evening, Undersecretary for Benefits, Joshua Jacobs. He leads more than 28,000 Veterans Benefits Administration employees in the delivery of non-medical benefits programs. The VBA provides disability compensation benefits to nearly 6 million veterans and their survivors, and administers pension benefits for over 300,000 veterans and their survivors. Through a nationwide network of 56 regional offices, special processing centers, and VBA headquarters, he oversees the execution of nearly $150 billion in direct benefits to veterans and their dependents. And he comes to this job after many years in the private sector and public sector, including a stint at the VA where he was senior advisor for policy in the office of the secretary. Undersecretary Jacobs, thank you again for joining us this evening.
Yeah, thank you so much for having me, Todd and Sean, and a special thanks to Hughes Turner for reaching out. Hughes and I go way back. And so back to the time when VBA was actually all paper bound, when the floors of the regional offices were literally buckling under the weight of all of the claims folders that existed across the regional offices throughout the country. And so appreciate what you do to pull people together, to share stories and to create this this important sense of community. And although you are called the Veterans Breakfast Club, I am mindful of the time. So I'll just have to go get some of the coffee when I get home. Yeah. I got plenty more work to do when I get there. I wanted to keep my remarks relatively brief and have an opportunity to open up for discussion and Q&A. But I think it's timely that we're meeting right now. We just celebrated the 1-year anniversary of the signing of the PACT Act, which is perhaps the largest expansion of veteran benefits and healthcare in a generation, if not ever. And the effort to make this law a reality was paved with a lot of hardship. It was setbacks and then ultimately success. I had an opportunity to speak to the Vietnam Veterans of America in Orlando at their annual conference earlier this summer. And one of the things that I shared there that I will share now is that we stand on the shoulders of Vietnam veterans. Vietnam veterans kind of fought for this country, and they came home to an environment that was not welcoming. Their service was not sufficiently recognized. They were disrespected, and what they did after that is remarkable. They basically said, never again will one generation of veterans let that happen to another. And their service over many decades has demonstrated the power of veteran advocacy. And were it not for that strong legacy of service and advocacy, I don't think we would have the PACT Act today. Nor would we have, many other incredible things like vet centers. And so I say that because I don't take for granted the fact that we have been able to demonstrate, notwithstanding, shortfalls, notwithstanding mistakes, kind of a legacy of commitment to the veterans of this country. And I think the PACT Act is incredible in that it expands the number of presumptive service-connected conditions to more than 20. We have 20 categories of healthcare conditions, many for the Persian Gulf War, as well as kind of the most recent conflicts in Iraq and Afghanistan, but also for Vietnam veterans. It adds hypertension and MGUS. It expands the number of countries that are considered covered, and it expands access to healthcare, which we know has an impact on improved outcomes and well-being. And the other thing that I think is important to note is we have just finished a year where we've engaged in the most proactive, forward-leaning outreach campaign in VA history. We have been actively working to try to connect with veterans and make sure not only veterans, but their families and survivors to connect them with their earned benefits. Rather than saying, come to us, we are using data to try to connect with veterans closer to where they are. I was out in Caribou, Maine earlier this summer. I'm from the West Coast originally, so this was my first time in Maine, but relatively close to the border with Canada, significant veteran population. And one of the things that struck me was that not only were we connecting with veterans who were eligible for the PACT Act, but perhaps hadn't received information, but we were connecting with veterans who hadn't thought about VA or had dismissed it, or perhaps weren't eligible but we're coming for the first time because they're hearing so much about that. And we have research that demonstrates that when veterans receive disability compensation, they have better health outcomes than those who don't. There's research that our health system did with Brown University to demonstrate that. We know there are better health outcomes. We know there are better economic outcomes. And so we're not stopping at this year. We're going to continue doing that. We have to figure out how to resource that sustainably. But I think what we're learning from this process are new and more effective ways. And one of the things I'll be interested in hearing from the group is, how are we doing? What are the things that we can be doing better? What can we be doing differently? I don't proclaim to say we've solved that, but I think we are doing a better job. And part of the reason I think we're doing a better job is I look at the total number of claims that have been submitted in this past year. We have received 42% more disability claims year over year. And, so we've received 42% more claims than we had at the same point last year. To me, that is a sign of success, that we are connecting with more veterans so that they can submit and file for their earned benefits. We've also been increasing the number of claims that we've been able to decide. So we haven't been able to keep pace at that same level. We've produced 16% more claims year over year. And so I think it's important, the last 2 years, we've increased total production. So in fiscal year 21, we set a record for the total number of claims decided. In the last fiscal year 22, we set another record, beating it by 12%. We got to 1.7 million claims decisions. And right now we're about 16% above where we were at this point last year as we come to the end of this year. Now, and I'm mindful that, we're not just talking about production. We need to produce decisions quickly, and they need to be accurate. And so our accuracy is a metric that we continue to focus on very strongly, and notwithstanding some of the early challenges where we're beginning to apply new law and kind of help train up the workforce, it has remained quite high. And so as we've done that, the reason we've been able to increase our ability to deliver more benefits to more veterans is we've actually grown our workforce by more than 20% over the last year. That's a significant undertaking. All of those people have to be trained. We have to, after going through the whole vetting and the interview process, we have to train them. It takes about 6 months to 2 years to be proficient. And then all of those people have to be mentored. We have to do their work. So it does come at a cost. But what we're seeing is that we're connecting more veterans with more of their earned benefits. And so we have to increase total production. One of the ways that we're doing that, in addition to hiring, is we're also increasing the use of new technology. So we're utilizing decision support technology so we can automate the pieces of the process that are relatively mundane. So we're going to let the computers do what they do best, pull together information, and we're going to let humans do what they do best, which is to make sure that they've got they've got sufficient information to make an informed decision. And so as we do that, we're focusing on total production, how quickly and how much can we produce, how many decisions, how many veterans can we serve through our decisions, the quality of those decisions, to make sure that we're not just giving you a fast decision, but it's an accurate one. And then the third piece that I think has been missing until recently, and that we're just in the very early stages of working on, is addressing the veteran experience. We're focused. We know that even if we provide a timely decision that is accurate, if we do so in a manner where the veteran feels disrespected, unheard, or ignored, that's a poor outcome. And that could be the difference between a veteran deciding to pursue other earned benefits like education and housing or healthcare, or turning their back on VA and just not continuing to engage with us. And we think that's a real problem. So I recognize we still have significant pain points in our process. One of those is the process by which you go through a medical examination for your disability exam, the C&P exam. That's a pain point. It oftentimes is It requires significant travel. The scheduling process isn't as flexible or effective as one might like. Sometimes it feels like the examiner is going through the process too quickly or not listening. So we're working on trying to tackle all of those things and balancing the need to provide, timely, accurate decisions. And then the last thing, I would say before I kind of open it up to make sure that we cover some of the bigger picture beyond what's going on with PACT and claims specifically, is that we're very focused. This is a people-oriented business. So we actually now have 31,000 employees, and our ability to deliver timely, accurate decisions and benefits, earned benefits, depends on our workforce having the capability, having the skills, and having the fortitude to continue driving in a very high pressure environment where the workload continues to increase and so does the complexity. So we're focused on ways that we can better take care of our people so that they can take care of veterans. More than 55% of the total workforce at VBA are veterans. Many more are military families, and everyone's a veteran advocate. I've been in this job for about a year, started in an acting capacity, and I got confirmed in the end of April. And one of the things that has really stuck out with me as I've traveled to regional offices across the country is how much employees care about doing the right thing. And they care about delivering timely, accurate decisions because they know how important it is for them in their own lives or their families' lives. And one of the kind of common tests that our employees ask themselves is this how I would want to be treated if this was my claim? And so that's kind of the northern light and kind of how we guide our decision making and our actions, which isn't to say that we always get it right. We know that it's a large organization and sometimes we don't make the right decisions, but it is what motivates us, and it is what I think drives people to keep coming back and trying to do a better job each day. The last thing I'll say, and then want to open it up for some questions, is people talk about the claims process, the disability claims process, and that is, I think, certainly what takes up most of the oxygen in the room when you talk about the Veterans Benefits Administration. But it's actually this is an organization that I'm guessing most of your most of the folks on the line probably know, and I think it's worth just reinforcing just in case. So if I can share my screen, just provide a high-level overview of the other benefits that we provide across the organization. So if you all can see this, this is going through the fiscal year 22. So the numbers are a bit outdated, but at a high level, I mentioned disability compensation. So last fiscal year, we paid out $124 billion to nearly 6 million veterans, but we also provide important pension and fiduciary benefits to over 300,000 beneficiaries. We provide over $10 billion in education benefits to over 800,000 beneficiaries. That's both veterans and in some cases family members. We have the Veteran Readiness and Employment Program that provides vocational rehabilitation. And we have Home Loan Guarantee, which is an incredible benefit that is quite competitive with the rest of the mortgage market, but is kind of a well-kept secret in some cases. We've got an incredible insurance program. We're now the 12th largest insurance program, including a newly launched VA life insurance program for whole life insurance. And we also do a whole lot of outreach. So a lot going on. And part of my desire to be here is to both hear where things are working well and in cases where they're not, to understand what those things are so that we can work on doing them better. So with that, let me stop, Todd. I will stop sharing and I'll turn it back to you so that we can engage in some conversation.
Thank you very much, Undersecretary Jacobs. We have Don Nemchek, a Navy veteran, Vietnam. You have your hand up. I'm going to ask you to unmute. Don, if you can. Let's see if it's working. I'll ask you again. Hey, Don, how are you this evening?
I'm doing well, Todd. Undersecretary, I'd like to firsthand welcome you to the VBC's Zoom calls. Veterans appreciate what the Veterans Breakfast Club has done for us, and I think you'll see the exuberance that we portray on these Zoom calls. I just want to share my experience with you. Under the PACT Act, I filed in October for my intent to claim, and in April, I was designated as a service-connected disabled veteran. Last Thursday, I went to the VA Center here in Pittsburgh to update my medical ID card to reflect the service-connected disabled, and I received my card today. So telling you that type of time frame, how well that system has worked for me, is attesting to your commitment and your staff's commitment to helping veterans. And I do want to thank you for recognizing the Vietnam veterans early on in your conversation. It means a lot to us, and I'm certainly appreciative of you recognizing that to us. Thank you again.
Yeah. Don, thanks very much for mentioning that. One of the things I didn't mention in my comments, but it is a priority, is working to try to escape the silos that have sometimes plagued the VA historically, and try to work. One of my main priorities is to work with our health administration and cemetery administration colleagues, as well as VSOs in the states and the counties, to make sure that we're doing everything we can to increase awareness about all of the earned benefits and healthcare that are afforded to veterans who have served this country. And so in some cases, it's about the ID card. In some cases, it may be, making sure that a clinician knows if a veteran comes in with a hurt back, but they require their body for their occupation, that they should know they might be eligible for VR&E to go get retrained. It's having those touch points across the system, or as you're thinking about end of life care, to know about the full suite of benefits that are available, not just thinking in a very siloed fashion about what we're responsible for. And so we've got more work to do, but appreciate that feedback.
Before Greg Yost asks his question, I'd like to go to Bruce. Bruce, you put an interesting question here in the chat to me, and I was wondering if you'd be willing to pose it here to the Undersecretary and to our group.
Absolutely. This is a question that gets above the numbers. Back in 1974, the United States went to an all-voluntary military. Before that, we had at one point over 40% of the men in the United States had been in the service. It's now down closer to 3%.
Yeah.
And I wondered, how does this extreme drop in the number, I should say percentage, of the population that are veterans affect your ability to get what you need in the way of resources?
Yeah.
In other words, you don't have as many people clamoring.
Yeah, that's a great question. What I will say is that while there has been a decline in the total veteran population, the actual reliance on benefits and healthcare has increased. And so what we'll see, and actually I can show you here, is there's been a total growth. There's actually been a 71% growth in the total amount of disability compensation benefits paid to veterans since 2016. And I think that's in part because one, you have an aging population, and so healthcare conditions, illnesses, injuries tend to get exacerbated, and the needs may increase. But you also have evolving military medicine, and so conditions that may have resulted and injuries that may have resulted in death previously. We've got battlefield medicine that has been able to save people's lives. And so we're seeing the benefits of that. But I would say there's also kind of a marked difference in terms of, I think, this country's support for the nation's military and the veterans. Notwithstanding the fact that we're currently in the middle of a debate about whether our government will continue to be funded starting October 1, I think there is largely broad bipartisan support about funding VA and funding the Department of Defense. People don't engage in that type of debate in the same way they do about other departments. And so I think there's a kind of more consensus around our ability to and the importance of funding here. But I think there's also, as the growth increases, and it's backed up by our data where we can show the increased utilization both on the benefit side, but also on the healthcare side. I anticipate there may be, discussions about what are the right priorities, what are the right kind of funding levels. So I don't take for granted that, we can just continue to coast on easy street. We have to demonstrate the efficacy, the effectiveness, and the importance of this funding. I hope that answers the question.
Very good. Greg Yost.
Yes, thank you, Mr. Secretary. It's good to hear from you, and thank you for administering these programs. I think that they're terrific. I have a very specific question, but I think it probably touches on a more general matter that applies to many cases. A Vietnam veteran I know had applied for benefits this past spring under the PACT Act, and he actually had some conditions that were presumptive under the new system. And over the summer, he had a variety of health issues that kept him in and out of the hospital and physical therapy, nursing homes, and the like. He was not able to get to his physical examination, which the VA had requested, and for good reason. And the VA was aware of this. He wasn't just blowing it off. And he, unfortunately, these health conditions caught up with him, and he passed away a few weeks ago. I know that his family was curious to know what the status of this was. They said they were going to look into it. I said I might be on a Zoom call tonight with someone who might be able to answer this. But a person who's applied, who has some presumptive conditions, and then passes away before the award, what is the status of that condition?
Yeah, I would have to go back and look at the details here, but there may be some eligibility for survivor benefits. If there's a way to get the details here to my email, I can ask my staff to take a quick look and to follow up with the surviving family. How first of all, I should have just expressed my condolences for that passing, and I'm sorry about the sequence of events. If you send me the details, I'd be happy to follow up. I don't know that we have the authority to provide kind of the veteran benefits given his passing, but there's the real potential that we could provide survivors benefits, and we offer disability and indemnity compensation. There may be some other benefits, and so we want to take a look at some of the details.
Okay, thank you. What's your email?
It's I'll share it here. It's joshua.jacobs@va.gov.
Thank you very much.
All right, thank you, Greg. Ron Giunta, Colonel, how are you?
Not too bad. Todd, how you doing, Todd?
Good.
Secretary Jacobs, I just want to thank you for coming on this call this evening, because it means a lot to veterans that Washington, D.C. is paying attention.
Yep.
Now, I live in a neighborhood full of veterans, a retirement community, and I've talked to a lot of veterans, and there's a big issue out there with veterans who were part of special operations, black operations, TDY operations, where they would fly into, let's say, Da Nang and be on the ground for a day, refuel the aircraft, and take back off.
Yeah.
And what's happening is, when you look at their duty form 214, it does not say anything about these classified missions. And I've had a couple of veterans tell me that they've tried to get copies of the missions or something to help them say they were in Cambodia, they were in Vietnam, they were in Japan and had to parachute into the jungle and do a special operation, and then they got extracted and they were there for a week, but there's nothing in writing saying they did what they did. But now these veterans are suffering from things like prostate cancer. They're suffering from Parkinson's, other cancers, a lot of the presumptive diseases associated with being around Agent Orange. What can these veterans do to file the claim and get the benefits that are due to them for their service to their country?
Yeah, that's well, one, thank you for raising that issue. We have staff who have clearances that work with the Department of Defense to get some of those classified records to demonstrate, evidence of service in some of these locations. And so what I will do is, in fact, one of the people who has worked on that is a guy named Rob Reynolds, whose career in Special Forces was cut short by an injury he experienced. I'm actually going to be, I think, going out to speak to a special operations group here next month. And so I don't have the specific steps here, but what I will do is make sure that I've got concrete information to make sure that you can share that with others, and that we can also kind of elevate that. I know we've got some guidance in our manual that if you search it up, but it's like reading Martian if you're not in the VBA system. So let me get that process. It's relatively controlled. I shouldn't say relatively, it is very controlled, because we have to ensure the protection of classified information while also ensuring that we're giving those veterans the appropriate benefits that they've earned.
I could understand classification. I worked in the Pentagon. I had a top secret security clearance myself, so I can really appreciate that. But send that information directly to Todd, and Todd can share that with veterans who contact him in regards to what do I do and how do I do it. And Todd, will help with that. And if it's okay with you, Todd might even be able to put something in a newsletter that helps veterans with this, so it goes wide, because there's so many veterans out there that are lost.
Yeah.
Ron, that would be fantastic, because we're getting more and more of those kind of stories, and I'm at a loss. I don't know how to respond to them. So if we had something that we, some direction that we could send people, that'd be terrific.
Yes.
Yeah. So I'll go back and make sure we get that, and then I will also double check it, just because I've talked about the process, but I will take a closer look, and to the extent that we need to update the way that we both communicate and then handle these types of claims, I'll go confirm.
Thank you very much.
Before I move on to Mark Spiridigliozzi, who doesn't give a whit about the Pittsburgh Steelers, I do want to follow up on Ron's excellent question with Karen, who put in the chat here. Let me read it, Karen, and then you could amplify, because I don't totally understand everything, all the details. My question is regarding your remarks of applying new law and making timely, accurate decisions. Can you provide an explanation of why the Gary Deloney and John Olson Toxic Exposure Declassification Act of 2018 doesn't apply to Vietnam veterans who served with MAC v. SOG and gaining access to their records for proof of boots on the ground for a service-connected claim? A battle we have been fighting for close to 3 years. My husband has a VSM, a Vietnam Service Medal, and OS, overseas bars, on his DD-214.
I unfortunately can't answer that. I don't know is the simple answer, but I will take that question. In fact, Todd, if there's a way to kind of send me that, or I can copy and paste it.
Right.
If that's okay.
I would love it. Karen, would you mind rephrasing or paraphrasing the issue?
Sure, absolutely. My husband, he's beside me here. He's an Air Force Air Commando veteran, 2 tours to Vietnam, served in SOG, CCN Da Nang, identified by the VA Pittsburgh with Parkinson's disease 3 years ago. And we have been in a battle. First of all, nobody within the VA system even knows what SOG is. I have had to educate them. I have asked for assistance from 2 congressmen, a senator, the president's office. I currently have his claim on appeal before a veterans law judge who didn't know what SOG was, who needed to be educated in the matter as well. I have done so much research, and I stumbled upon this act this summer. And I have been asking everyone from the congressman's office to the senator's office to the director of the Pittsburgh VA, why this law that was signed into under the National Defense Authorization Act of 2018 doesn't apply to MAC-VSOG records because we have been told that his records are still classified. I have asked for records from the National Records Depot until I'm blue in the face. I've even tried to get his Walter Reed treatment records where he was taken after his last mission. I can't even get those. How can I prove boots on ground when I look at his OMPF? It looks like he went to basic training and was discharged. Everything in between, all the specialized training and everything is gone.
Well, Karen, and I'm sorry to interrupt here. SOG, Studies and Observation Group, was originally known as Special Operations Group in Vietnam, did classified special operations. But you say here in the chat that he has a Vietnam Overseas or Vietnam Service Medal on his DD 214. Won't the VA recognize that?
They want to see orders in his file. And he was TDY. He never deployed. He was all MAC-VSOG was all volunteer.
All volunteer, right.
So he never deployed with his parent command. He left out of the SAC Air Base in Arkansas on his first tour and out of the sister SAC base at Ramey Air Force Base in Puerto Rico for his second tour.
Yeah. Well,
We can't get records. How can I prove it? I'm trying.
Yeah.
I even found a CIA classified document from 2011 that said that all MAC-V records are to be returned to the Joint Chiefs of Staff and kept at the classified level. So if that's where the records are, how is a veteran supposed to gain access to his own records?
Right.
He went and did his duty. They have a responsibility to keep his record. We don't want to know mission details. We've already shared that with the Veterans Law Judge. We simply want verification that his boots were there.
Right. That's it.
Yeah. So what I would ask, Karen, is if you could send me information. I don't want, if you're going to include social, just the last four. I don't want any PII violations, but I'd like to follow up on this. And maybe what we can do is through the kind of focus on your husband's service and his claim, maybe there's a way for us to crack the broader nut on this issue. I think, we obviously can't make decisions about what's classified or declassified. That's a DoD issue.
Right.
I will be at the Pentagon on Thursday for what we call the Joint Executive Committee. It's a regular body that meets to work through a variety of DoD VA issues. And so what I'd like to be able to do is and maybe bring this over and while I'm there, I can talk to some of my DoD counterparts while I'm and see what I can find out before then.
Karen, please email me the details and I will pass it on to the Undersecretary's office, todd@veteransbreakfastclub.org. Thank you very much. I can tell that you're a Steelers fan. So thank you very much for taking some time with us this evening and sharing that story. Mr. Spirdigliozzi, how are you this evening? I'm going to ask you to unmute.
I think I got it. Did I get it?
Good to see you, Mark.
Good to be here too. Undersecretary, it's great to hear you speak and be here tonight. I'm here for a couple of reasons. Number one, I want to tell you that I am elated with the Veterans Administration Benefits Service. I was diagnosed with lung and liver cancer in June of last year, associated at 100% to Agent Orange. Lung removed, liver resectioned, all of that done. And by the time I had the lung removed, I had applied for benefits. 6 days later, I went through C&P. I was approved from September until the end of November, and I was done with having everything done and in place and received my first payment in December. That I just think that's amazing when you think about this deluge of claims that you're getting every day. And we all peruse the websites and Facebook, and we see all the complaints. But let me tell you, if you ever need a success story, I will gladly stand behind everything that the VA benefits have done for me. A couple of questions, though, are: is the staff? I'm doing a lot of this through community care.
Yep.
And not that there's anything wrong. I'd rather like it because I live right across the street from a cancer institute. So
Yeah.
it makes it very easy to get it done. But with this growth that you're seeing, and you're seeing your people's numbers grow just in place, is the healthcare system at the VA increasing at the same level? Number one. Number two, the community care network works well if you are good with a computer. I'm sure that there are people out there that are not very good at navigating the bowels of the network that happens there. That would be my only disparaging remark, is getting through that CCM and getting it approved. And then I've got liver cancer, lung cancer, and I'm having a cochlear implant done. Those are all different CCN numbers, and they keep getting those mixed up. So there needs to be something that intertwines all of this, so that you say to the veteran, here's one number, use it, and we'll get it back to you. So, but believe me, I am not complaining. I am elated with everything that's happened.
No, well, one, I appreciate the feedback on the experience. I'm sorry about your particular conditions. It sounds like you are fighting through it, and I will say it's great to hear these types of success stories, because I think it encourages others who may be on the fence about whether to pursue these earned benefits or not. It's also important for us to hear when things are not working, so that we can make those improvements. With respect to your question about community care, and at the risk of talking about kind of the health benefits, which I don't oversee but are overseen by Dr. Elnahal, I would say that the broader healthcare industry trend right now is increased utilization. And so certainly the proportion of care that's going to the community has increased as a result of some recent legislative changes. But there's also, you're seeing an increase in both utilization and intensity of healthcare, both in the VA system and in the community. And so those are anticipated to increase. So similar to the question we discussed earlier about a declining veteran population, what you're seeing is that the utilization, the intensity of the utilization is increasing, and the costs are increasing not only as a result of that, but also based on just general inflation that you would expect to see and is being experienced across the industry. And we certainly have some factors that work in our favor. So the way that VA manages the drug formulary actually helps contain costs, but also promotes efficacy based on what the data is, not just, there's a very data-driven kind of medically oriented formulary. So I think the broader point is something that I will take back to the Undersecretary of Health. He'll be here in my office bright and early tomorrow morning, and I can mention that. One of the things, VBA is relatively new to veteran experience when it comes to the disability claims process. We just started on this journey in the fall, about a year ago. We've been doing it in other parts of our business, but VHA has been intentionally working on that. And obviously, an organization that has 9 million enrollees, there's a lot of opportunity to both get things right and get things wrong. So I will reinforce that. And I know that it's a major focus area for him.
Thank you very much. Hughes Turner, Veterans Breakfast Club board member, retired Army colonel. How are you, Hughes?
Hey, every day's a great day above ground. And Josh, thanks for joining us. Of
course, good to see you.
There are just 3 comments that I want to make. Number one, thanks to you and your team for being advocates for the PACT Act. Individuals like yourself, and then of course celebrities like Jon Stewart, who helped push this across the goal line last summer to get this act passed. The other point I want to make is I think it's important for those of us who served in Southwest Asia to go to the burn pit registry.
Yes.
And get yourself registered, because it tracks where you were in theater and when. So more information that's available to the veteran and, of course, those who may be processing the claims. And lastly, there's another component, as you know, to VA, the Board of Veterans Appeals.
Mm-hmm.
And unfortunately, one of my conditions was originally denied service connection when we filed years ago, but is now a presumptive under the PACT Act. And so what we tried to do was also apply under the PACT Act for my circumstance. But we were informed that because there was already a pending appeal,
Mm-hmm.
either with VBA or the Board of Veterans Appeal, it would not be considered under the PACT Act concurrently. So that's just a commentary on my part, that one thing that we may want to consider is leave that option to the veteran on whether they want to continue with their current appeals, whether it's with VBA or the Board of Veterans Appeal, or whether they want to remove themselves out of that lane and into the PACT Act, which would be much quicker. But I also understand that keeping it in VBA going back several years, the potential for more back pay is a vice, and that's the dilemma that we're faced with. So I just wanted to make that comment and underscore that to the group.
Yeah, Hughes, I think that's a very important point, all three, but appreciate you raising that, and I always enjoyed working with you. So it's good to see you. On the last point, maybe I'll work backwards here. It's a very good point, right? So the great thing about presumptive service connection is we only need two of the three main parts, right? We need to provide a benefit. We need evidence that you served in one of the covered countries and one of the covered periods of time. We need evidence of the medical condition, and then we automatically assume a relation between the two. We don't need to do that extra third step, which is often the most time consuming, which is to develop the nexus, the causation, correlation, right? It's kind of, we don't need to do that. That takes a lot of time to develop the evidence, the theory of the case. And so in the cases where you're applying for direct connection and it's going back for an appeal, right? So the thing about the PACT Act is we can backdate benefits going back to August 22nd, or August 10th, 2022. That's the earliest possible date. And so that's why we were pushing so hard going into the August 9th timeframe. We probably saw a lot of communications, file now, preserve your effective date, submit an intent to file, because we wanted veterans to know that if they did that, they could be backdated to the date the law was enacted, when the president signed it. If you've got an underlying claim that is going to be evaluated not as a presumptive, but as a kind of through the normal process, there is the potential that it could go back even further, but that's a different standard. And so that it's a question of, do you want to move forward with the presumptive where the effective date could be, August of 2022 or maybe later, or however far back the original claim goes. And that's something where kind of working with a lawyer or working with the VSO, it's important to make that kind of informed decision. The second point that you made, which is about the burn pit registry, I think it's really important. One of the great things about the PACT Act is it established these 20 plus categories of conditions that are now presumptively service connected. And that just makes it easier for us to say yes, which is what we want to do. But it doesn't stop there. So we are required under law to every year to formally consider new conditions for potential establishment as a presumptive service connection. The only way we do that, the only way we can do that is by trying to drive the science and the research forward. The burn pit registry is an important part of that. It's not only filing the claim so that we can get that data, but it's also signing up for the burn pit registry so that we can better understand the true long-term impact of the cost of war. And so the more information we have, the more likely we will be able to kind of have sufficient evidence to make the case for the establishment of new presumptive service connection. And I think that's important not only for the state of the science and so that we can do more, but it's an important selling point to some veterans that I talk to, because I talk to veterans and they say, hey, you know what? I don't deserve it. There are other guys, girls that need it more than me. What I have isn't so bad, you know. And what I try to say is that, okay, understand where you're coming from, but you've earned this benefit, number one. Number two, it's not just for you, it's for your family. So after you're gone, there's survivors benefits. There are other healthcare benefits, other VBA provided benefits, but it's also for your fellow veterans, because the more we know about it, the more we'll be able to take care of other veterans. And then finally, what I would say on the advocacy piece, Hughes, what's interesting is that, as we were having this debate about whether to pass the PACT Act or not, one of the arguments that was used, and I still hear periodically, is, well, it's going to increase your workload and increase your backlog. Well, I'll tell you what, our inventory is now over 1 million claims for the first time. Our backlog is approaching 300,000. And while we're doing everything we can with people, process, technology to drive that down and to provide timely, accurate decisions with a full veteran experience, I actually see that as a good thing, because the more veterans who are applying for their earned benefits, the more we're going to be able to serve. And so I think there is this kind of trade-off, right? Like there's an analogy that someone shared with me. It's like, well, would you rather have a line to wait in or no line at all? Like preferably you'd have a line with very few people waiting. But as we're working, and we've grown by 20% as a total workforce, we're increasing the use of technology. We're trying to reduce overdevelopment. We're taking a holistic perspective and trying to drive this forward. I think the fact that we're actually able to deliver these benefits is an incredible thing. It's why people sign up to work at VBA, why people come to work, and it's going to keep us driving forward.
Pat Hughes, Army veteran, Vietnam veteran, lives in Texas, just expressed his astonishment. Oh, I hear some feedback. I'll let you talk, Pat.
Well, thank you, Todd. I appreciate it. Mr. Undersecretary, it's an honor to speak to you. And for the record, I want to say that the VA has taken very good care of me. Although it was a fight and a struggle, I had to earn it the old-fashioned way. I had to fight for it. I am 100% totally and permanently disabled. However, we still have some issues. Number one, by the VA correspondence that I've received, I was notified that I was rated a 10% disability in 1977. I submitted an inquiry through the VA office in Austin, Texas, and we waited 2 or 3 months and nothing happened. So I submitted a formal claim, and I have the documentation. I didn't even know I was 10% disabled. Long story short, I got a copy of the rating decision through the VA records, through the VA, that was dated 1977. So they owe me 47 years plus of a 10% disability, of which I've never been paid. Now, I'm not worried about the money, but I just want you to understand that things do fall through the cracks. I'm very grateful to the VA. I've had 3 total knee replacements by the VA. I'm 100% disabled, as I said. You're my primary care, medical care, but there are some issues that need a lot of work. And number one, I understand from my RSO officer there in Austin that the PACT Act is silent for Vietnam veterans on burn pits. Now, I did sign up for the burn pit registry years before even the PACT Act was even known. Yet I understand from what I'm being told that that we can't get any help for upper respiratory infections and other issues, asthma and bronchitis and other issues. Also, that is a problem if that's the case. So that's what I've heard, but I just want you to know that you're doing a great job, but there's more work to be done.
No, thank you very much for those comments. And I am very mindful in an organization as large as VBA that we don't always get it right. But we have a commitment to identifying those issues and then communicating about them transparently, telling folks kind of what we're doing and where we are and where we're going. You're right that the PACT Act does not. It expands the presumption for Vietnam veterans by including additional countries that are considered in country, so boots on ground for a variety of presumptive service conditions. And it also adds 2 new service connected conditions, MGUS and hypertension. But it does not include some of the other conditions that are listed for the Persian Gulf, the 9091, and then beyond for the asthma, rhinitis, sinusitis, et cetera. And so the issue that we have is that our process to formally establish new presumptive service connected conditions is not the same as the process that Congress can use in terms of legislating those. So requires, and this is the whole reason behind the presumptive service connected process, where the research hasn't caught up. We have enough to tell us where we think there is room to grant in favor of the veteran, but where there's a varying level of kind of criteria, and so we have a more robust criteria and a kind of more regimented process within VA that we have to follow that includes rulemaking, issuing regulations. It requires publication of the science and our evaluation. And Congress considers all of that, but ultimately they have the ability through that robust public debate to make decisions in a way that we simply can't. And that's the way the system's designed. So I know that there has been, a fair amount of discussion about, how to deal with that. And that was, something I've talked to the Vietnam Veterans of America about and some of their leadership and other veterans as well. So I appreciate you raising that.
We have Gary Glick, who's the commander of the Department of New York Jewish War Veterans. How you doing, Gary?
Okay, just give me 1 second. Hi, I'm doing okay. I just had a quick question. I know the reservists don't get anything at all from the VA, but I have a question. I have a case, for argument's sake, where my brother-in-law, he was in the service, in the reserves, but he was there for 6-7 months, and they drummed him out because they found out he had trouble with his eye, and I was just curious on that. And I know the reserves don't get anything at all.
Yeah. Well, first of all, Shana Tova. I was just down in. I was with JWV down in Jacksonville not too long ago.
Yes, I heard you there. I was online listening to you.
Yeah. So this is an issue. If they served in the if they were not activated for a sufficient period of time on federal orders, we have limitations in terms of what we can provide.
Right.
So I assume it was just state orders. Is that correct?
Mm-hmm. Yeah.
Yeah. My sense is that we're somewhat limited in terms of what we can do, but happy if maybe there are extenuating circumstances or some details that just not thinking of that we could take a fresh look at. I think this has been a long-standing debate about whether to kind of adjust kind of the definition of veteran under kind of federal law.
Right. Now I had a question. Did I have him write down, because he told me the story, what happened? Mm-hmm. Could I actually have him do that and maybe just put it through the VA, and if it works, it works. It doesn't, it doesn't.
Yep. If you send that information to me, whether through Todd or Hughes or directly, that way it would just may be helpful, maybe to kind of funnel. And I don't want to clog Todd's inbox. But
no, because I know it's true, because I didn't know this either. Someone called me up and he was a month in active service. He was active.
Yeah.
But what happened was he didn't know 50 years ago that he would get this $109 a month in New York. So I happened to tell him that. And he says, but I didn't know after a month they would accept it. But I went and sent it to the VA, to our VA here in Northport. They took care of it, looked at it, and realized. I said, wow, after a month, they took care of it. Because it's also kind of funny, too. I had the same thing happen with aid and attendance. My own father was there for 6 months during World War II. and he served his 6 months, and that was perfect timing to get my mother the aid in attendance.
Yeah.
But my mother-in-law, her husband served for only 5 months, and she couldn't get it. He ended up going for 90 days, but they drummed him out again because it had to do with a problem he had with his eyes.
Yeah.
And the irony is his children inherited it, but they didn't know this until they got into the service, or even same thing like my wife. She never knew she had it till she was 18 or 19.
Yeah.
And today she is legally blind, and just like her two brothers. But one of them, like I said, went into the service. He was in the Marines, and he told me the story of what happened. It really blew my mind. They said is they put him out after 6 months on night maneuvers, and they told him, "Could you see my rifle?" And he looked around and said, "Where is it?" And then they realized that he had night blindness.
Oh boy.
And they said, "That's it, you're finished."
Yeah.
All right, thank you.
Gary. Thank
Yeah.
you, Gary.
Yeah, and what I'll just say is that, various programs and benefits have different eligibility requirements. So depending on what kind of you're applying for, we can just take a look at it. But there tend to be things that are just defined in law that we just don't have flexibility. But we'll if you send it in, take a look and see if there's any flexibility that exists or not.
Justin in Dallas, how are you?
Well, good afternoon, as we say in Dallas, Texas. Josh, I want to thank you. I have a very nice doc at the Garland VA in Dallas, Texas. She's made sure I got vitamin D.
All right.
But the big one is that I'm one of those that has done nothing with the Agent Orange. We dropped the battle. We actually had Agent Orange mission from 25th Division. I wake up every morning and I tell people if I'm hearing ringing in my ears, I'm still flying helicopters. But I think one of the things is that, and I got this from my cousin who's 100%, that he said, you got to go in and at least apply.
Mm-hmm.
I haven't done that simply because I didn't think it was that bad. You're telling me maybe I'm wrong. I should at least go in and get the list done and take I at least have my flight records and know where I was in country both times I was there. So I just want to, I say that because another person who flew with me, who became an admiral in the Navy as a doctor, always said, he always asked in some Zoom calls we did during COVID, are you still taking a shot of bourbon before you go to bed at night? And I tried to say yes most of the time. And he told all of us that's a good thing, keeps the virus sort of at bay, so he doesn't know what he's doing. And I don't know. I'm just one of those that says I've been lucky. I haven't been really sick. I have an L5S1 that I have nurtured for 50 years to make sure I didn't have to go to surgery. And I look at the guys up here, and we've been there, done that.
Yeah.
So I thank you for what you do. The next thing I have to do, though, is go down and make the VA change my name from the second to the third. When they input it, they put it as the second. So I'm assuming I'm a World War II veteran still alive. That's my father.
Oh boy.
Hey, Justin, thank you.
Well, Justin, one, thank you. Two, speaking of things that should be easier and than they are, changing the name in our system is actually harder than you would imagine, given the kind of interchange between the health system, the benefit system. But that's, if you flag that for me, I can try to follow up on that. I will say, please do go apply. One of the things I worry about is I hear people suggesting you need to pay someone to apply for benefits. You have incredible veteran service organizations. You have county VSOs. You have the states who support this. There's no need to do it. These folks know what they're doing. They do a good job, and they have a lot of history. And so I would suggest kind of consult with a VSO, and then figure out what's possible. And it's not just for you; it's for your family, because you've earned these benefits through your service.
Ron Giunta.
Yes, here's a comment for Justin. Justin, if you go to the federal building in Dallas, you'll find that the VSOs are located there. Their services are for free, and they can file your claim electronically, number one. Number two, do not discount the fact that you've got ringing in the ears or hearing issues and not filing a claim for that, because there are veterans out there who have hearing disorders that develop into even more complicated things. And once your foot is in the door, you're in the door. If things get progressively worse, you can file for an increase, and the VA will, and once you're rated for hearing, the Veterans Hospital will take care of anything that's tied to your hearing loss or tinnitus. Even if you start having vertigo or issues with balance, do not delay filing your claim. Now, the other thing is, Todd, I put in the thing, what if a service member, active in reserves, is injured during initial active duty for training, like basic training or tech school, okay? And they're disqualified, they're permanently disqualified from worldwide duty by the military because of the injury they incurred at basic training or tech school. And now, the military basically disqualifies them and releases them or medically discharges them. Can those veterans come to the VA and file a claim for something that happened 40 years ago at basic training or at technical school or upgrade training, even though they had not done their initial tour of active duty following their qualification training?
Yeah. I want to double check. I think I know the answer, but I don't want to give you the wrong one. So let me just double check on that and make sure that I'm not misspeaking.
Okay. Wonderful, wonderful question, Ron. Thank you so much. Sue Watson makes a terrific point. Thank you for joining us, Sue. Everybody should know where their DD-214 is. Everybody should be able to locate it. And everybody should have family members or friends who can locate that DD-214 for you in case you can't do it yourself. So thank you, Sue, for that reminder. I want to say hi to Fred Tittle, California. It's been a while. Good to see you, Marine. Thank you very much for joining us. I always like to see people who I haven't seen in a while. It's so wonderful to have you join us. Yvonne Sawinski, I missed this in the chat, so I want to go back. Yvonne put this, and I don't know if you need more details, Undersecretary Jacobs, to answer it. Are survivor benefits for a spouse who passed 3 weeks prior to PACT Act valid as additional presumptive illness have been recognized? Okay, maybe I'm not reading this correctly. Intent to claim has been filed. Records are no longer accessible when intent was filed. Yvonne, if you want to unmute yourself and ask it in a more eloquent way than I did. Hi, Yvonne.
Oh, hello. Hi, I'm Yvonne, and I'm a widow of a U.S. Air Force. He passed in July 20th of last year. And what I wanted to know, I did file a claim of intent for survivors' benefits. I know over the time, probably about 4 months before he even passed, he was trying to probably increase his rating. But after the August 10th signing of the PACT Act, at the time, I didn't pick up on that, what benefits could be valid for survivors, either whether widow or regarding his rating, and also to the fact that two more presumptive illnesses appear, like pulmonary fibrosis was one of them, other than PTSD and another that was a valid for to continue on with my intent claim, or what survivors can benefit from that if that's valid, like since he passed like July, like 3 weeks before. And I just wanted to know, to clarify that for myself, or how to continue with that. I did go to a VSO to start to file that intent.
Yeah. Well, first of all, I'm very sorry for your loss, and kind of recent loss. And so I hope that your husband's memory continues to serve as a blessing. Second, I would say that the PACT Act includes survivors' benefits, so it doesn't matter timing here. What I would suggest you do is go to, in addition to working with the VSO, there's more information on va.gov/PACT, PACT. And so surviving family members may be eligible. There are kind of three kind of survivors' benefits. One is dependency and indemnity compensation. The second is one-time accrued benefit payment, and the third is a survivor's pension. And there are different eligibility requirements. So depending on the circumstances, kind of your individual circumstances, you may or may not be eligible for those. But I think that's something that a VSO could help with. I can also work to get your contact information, have someone from our office's survivors assistance reach out and kind of talk through the details to figure out what you may be eligible for and figure out how we might be able to help you access those benefits.
Thank you for answering that question. Bob Miswa, how are you?
Pretty good. I just had a quick question for Undersecretary Jacobs. Since he's going to the Pentagon tomorrow, is that it?
Thursday.
Could you ask them down there if it would be sufficient for them to send a letter to the VA saying, hey, Joe Smith served in Vietnam on several days. In such and such year, we cannot give you the details because they are secret.
Yeah.
Bang. You know, or would that be against VA regulations that, oh, we can't accept a letter from the Pentagon. We need it on the DD-214. Is there
Yeah, no, we actively work with our DoD colleagues to get information. You know, sometimes we can just get, we can get buddy statements. It could be like that if it's not on the DD-214. So we look for ways where, it may not be otherwise available to get that. And so we do get information from DoD. One of the challenges, we've been working with the Department of Defense is trying to kind of automate the data. So rather than having to formally request information, we want to have access to information so that we can very quickly and easily access that kind of data. And it's a valid concern where they say, hey, we can't tell you, ship coordinates even 60 years later because it's still classified. But we don't need the ship coordinates. You just tell us if it's in a place or not. We don't need all the details. So we're looking for ways to make it easier for us to meet the requirements under law to affirm that you did in fact serve in a location in a certain time without getting close to this concern about violating security concerns.
Bob Von Bargen. Sorry, you're German, not Dutch. Von Bargen. How are you?
Very good. How are you, sir?
Good. I'll be seeing you in 1 month this week, 4 weeks this week.
October 20th, Friday.
That's right.
I do have a question. The VA has treated my son for many years, and wonderful treatment with the VA hospital in Lebanon, Pennsylvania. He recently had a problem, and he was hospitalized, and they couldn't treat him at the VA hospital at Lebanon. They sent him over to Reading. And then there was a problem of sharing electronically the medical information back and forth. And my question for Mr. Undersecretary is, what is happening with the VA? Maybe just that one VA facility is behind the scene, or just what is happening so that for us, say in Pittsburgh and here in South Jersey, hospitals, they interlink back and forth. The information is readily available, and that was not available. And his care right now is being held up until, I guess, paper records get sent over. And so basically, what's going on? And regarding your visit next month, I was over there and we checked the place out, and we're ready for you.
We are doing. Yeah, go ahead.
A question on Reading. Is this? I'm familiar with Reading, California, but is this
Reading, Pennsylvania?
And this was a VA.
It's a VA hospital in Lebanon, Pennsylvania. It's east of Harrisburg.
Yeah, no. So I'm familiar with the one in Lebanon. My sister actually did her residency at Penn State.
They're wonderful people there.
Did some time kind of working at that hospital. But I'm not familiar with the Reading one. So is that a community hospital?
No. Reading is the St. Joseph's Hospital. That's the basis of my question. Is going from the VA records to a private to St. Joseph's Hospital, which is part of the Penn State medical system.
Yeah. So, there are, and I'm going to very quickly, overstep my my area of expertise, but my understanding, right? So we're still in the majority of VA hospitals still relying on what is called the VISTA system, CPRS, and working to update with a new system. But in a lot of other systems, they use Epic or Cerner, or there are a handful of other systems. And so there have to be data exchanges for interoperability purposes. I know that the VA health system has a process by which they exchange records, but I don't know the specifics here. So I'd be happy to follow up. I'll have the Undersecretary for Health here in my office tomorrow morning and figure it out. But if there's something that we can do immediately, if it's
no, it's nothing immediately. It's just a question.
Yeah, what I will tell you is, as someone who gets his healthcare outside, when I go to different systems, it's the norm for most healthcare. That healthcare in this country is fragmented, and so it's the real benefit of VA health is kind of the way that it operates in an integrated manner, and it puts the patient needs at the center. So it's not about optimizing profit or kind of getting like the most highly compensated procedure, but it's what makes the most sense. How do we keep the individual healthy? And so electronic health record systems are, I think, largely designed to optimize revenue. And so they serve that function, perhaps more so than others. But I think I apologize. I'm sorry that your son had that experience. And if there's anything I can do to help, I'd be happy to.
No. The care has been fantastic. And I'd be the last person to complain, because it's not a complaint. People are wonderful out there at Lebanon.
Thank you, Bob. Undersecretary Jacobs, you've been extremely generous with your time and taking so many questions. You've given us way more time than you promised in the email. We end our program in 12 minutes at the bottom of the hour. I want to give you just a thank you for joining us. I know that you have a pile of work to do tonight, so please do feel free to take leave. And thank you again for spending so much time with us.
No, I very much appreciate it. I'm going to head home shortly and go tuck my kids in and start the second shift. But I just want to say thank you for inviting me. This has been the best part of my day. I really, it's very easy to get caught up in the kind of the internal machinations of trying to get things done. But this is, why I do what I do. It's to kind of deliver earned benefits to the people who've kind of enabled me to live in peace and security. So thanks for what you do. Thanks for what you continue to do for others. And thanks for allowing me to join you this evening.
Thank you so much. Good evening. Take care.
All right. Take care.
Hey, I want to continue the conversation, if you don't mind. We have 11 minutes left in the program. I just thought he promised maybe half an hour with us and gave us much, much more than that. So I wanted to give him a chance to get off and get on with his work. Pat Hughes, could you please post his VA email address? I actually didn't catch that address, but I will. He did give it. He gave it verbally. I'll look it up here, or Sean, if you're available, if you want to look it up and put it in the chat here. Ron Giunta, could you describe to us what a buddy statement is? He mentioned that.
Sure. Okay, a buddy statement is a statement from either the spouse of the veteran or somebody the veteran was in the military with that actually can provide information in support of the veteran's claim. And I have one really good example about a Vietnam vet who had applied for sleep apnea 50 years after he was discharged, and he was turned down. So he went back to his buddies that were with him in Vietnam. And the story goes that this Vietnam vet snored so loud that the snipers were honing in on his snoring.
That's horrible. I'm laughing, but that's not funny.
No, it's true. And three of his buddies that were with him in the foxhole all gave written statements attesting to the fact that he would stop breathing, he was snoring while he was in the foxhole. They have to wake him up to get him to breathe. They have to wake him up to tell him to stop snoring because the Viet Cong were honing in on his snoring, trying to take them off. Well, those buddy statements issued by his 3 military friends, 3 different statements, were used as evidence in approving him for 50% disability for sleep apnea.
Wow, if that's not a violation of HIPAA to pass along who that was, that's a great, I mean, that is one heck of a story, just as a war story, but to have it, be involved also in a VA claim.
Right.
Amazing.
I was told that story by the folks at Bethesda Naval Hospital when I went for my sleep study. It was part of the briefing, but a buddy statement is something, and even like, let's talk about SOG. If somebody was with a veteran during a dark operation in Cambodia or anywhere where that is not a publicized mission, even if they were like a commander, if they can give a statement to that effect and sign that and say what their position was when they did this, what their relationship was to the veteran, that statement could be used as evidence for a claim. That's the buddy statement.
Ron, and I asked Karen to unmute just because I have the same question that Don Nemchek put in the chat here. Why are SOG records so tightly classified all these years later? Do you have any idea, Karen?
I've been researching for 3 years. You wouldn't believe some of the documents that I have stumbled on myself. I actually found a document dated 2011, November 2011, from the CIA that says that all references to MACV SOG and U.S. Air Force assets are to be returned to the Office of the Joint Chiefs of Staff and remained at classified level. I turned that in as part of evidence to my husband's appeal to the judge. If that was still the case in 2011, I know it's 12 years forward, but where are the records? Yeah. I mean, my husband has a compromised memory now. He has Parkinson's with severe cognitive impairment. He can't remember who he served with. As we said, a lot of those guys, they didn't get close to each other over there because they didn't know if they were making it back. And, his last mission took him out and he ended up at Walter Reed Hospital. I've tried to gain access to those records and I was told that I had too many requests in at the MPRC. Our attorney has filed for them as of this past January. He hasn't gained access to them either. But, he was allowed to give testimony to things that he could remember about missions, and we did submit that as part of our evidence, and that's in his file, in his case file. But I don't know why SOG records are so hard to get. First of all, everyone in the VA they didn't even know what it was. I had to explain to them what this unit was. I responded to an article that I read at Military Times. It was from Colonel Paris Davis, and his article said that he appreciates all the support that he got in being awarded the Medal of Honor, but he said the true heroes of the Vietnam War were the members who served in SOG, and that they have gone unrecognized. And he said there are a lot of efforts with him and others who are approaching Congress to support those members who perished as a result of their SOG operations, those who made it back and those who are still alive. And, I responded to that, and I actually got a response from the journalist and the editor of the Military Times, and they said that they got quite a few opinions on that piece and they're going to publish them. So I'm hoping that maybe I get some movement on this. A lot of this, Todd, is really about recognition for service, not about the benefit.
Right.
I mean, how do you send a serviceman? You're familiar what that unit did. How do you not verify that they were there now? It's 54 years since he discharged.
Don Nemchek put in the chat, and I completely agree. May we all have a loved one in our lives as devoted and as determined as you are with your husband. He's a very lucky man to have you fighting his fight for him.
Well, I appreciate that, but he has shared with me what he had to do. I tell him all the time, his story is like for a Bruce Springsteen ballad. It's just unbelievable what they went through. And, you know, the training that he had to go through to become special forces, you know, qualified. And yet, where are the records? And I've been told that part of the issue is TDY service for the Air Force. You know, I reached out to a FOIA office. I've talked with the FOIA office at Randolph Air Force Base. I'm on a first name basis with somebody down there. And he told me, Karen, you got two problems. You got TDY service and you got SOG.
Yeah.
He said, lots of luck.
2 strikes against you. Yeah.
Mhm.
And I'm just happy also that you have an attorney working for you. That I was going to suggest you got to have one of those if you're in as deep as you are at this point.
Well, I do more work.
Yeah. Okay.
I do more work.
Yeah.
I'm vested in this because I see the veteran. I love the veteran, and I just know the story. And I have read so much on this unit. I didn't even know he was in. I didn't even know what this unit was until 2011.
Yeah. You know,
because he kept it secret. He said,
Yep.
I signed documents. I don't talk about this.
Hughes Turner says we tend to overclassify everything. Thank you, Hughes. And thank you also, Hughes Turner, for making this program possible. And also for sharing Joshua Jacobs' email here in the chat. The chat has been shared. If you want to scroll through and get that email, you could do so right now.
Well, you want me to send my information to you, though, Todd? You can look. Or
Yeah.
you send it to him. Send it to
I
you.
would like to see it. Would you please send it, CC, maybe send it to him, CC me on it?
Sure.
Okay. Thank you very
I
much,
can do
Karen.
that. Mhm. Yeah,
I
yeah.
appreciate
Right.
that. Hey, I want to thank everybody for joining us tonight. I know this is not the usual, you know, kind of programming that we do centered around veteran stories, but I think it's a very good and important conversation to be had in the veterans community. And as somebody who is not a veteran, I'm educated when we have these kind of conversations because people often, you know, send their conundrums to me saying, hey, how do I access this benefit or service or resource? And the more educated I am, I think the more helpful I could be in my role with the Veterans Breakfast Club. So thank you all for coming and making it a great conversation. And what I love is that, you know, many of you have had good experiences with the VA. Many of you have had not good experiences with the VA, Pat Hughes, and we're still able to have a respectful and civil conversation. And I'm very proud that we're able to do that week in and week out when we're dealing with some pretty tough life and death and family issues. I love you guys. This is my favorite part of the day also. I hope that you'll join us Thursday night when we talk about just war theory. Ben Wright and Greg Yost leading that conversation. I'll be on it too, chiming in, trying to remember St. Augustine of Hippo from my Jesuit education days. And then of course next week we'll be back with Alex Kershaw. All right, go Steelers. Good night, everybody. Happy birthday, Air Force. Take care.